Hello, my name is Heather Pham. I'm a fourth year pharmacy student, and today I will be presenting on menstrual cramps. I will be focusing on the adolescent population, so most of the information on the slides will pertain more towards teenagers. There are still some information that pertain to adults as well, but again, today we'll be focusing on adolescents. The learning objectives for this presentation is to discuss types of dysmenorrhea, also known as menstrual cramps, risk factors, and causes of those menstrual cramps, to identify common characteristics of dysmenorrhea, to understand how dysmenorrhea is diagnosed, and what to have prepared when at a doctor's visit, to recognize the treatment options as well as non-pharmacological interventions that can be made to minimize the pain, and to understand important counseling points for the medications discussed to ensure safety when medication is used. Dysmenorrhea, also known as menstrual cramps, is a condition in which severe contractions of the uterus during menstruation or an underlying cause results in painful menstrual cramps. Peak onset is usually late teenage years to early 20s and decreases in prevalence after 30 years old. This does not mean that younger children cannot have severe menstrual cramps, but the peak of the pain usually occurs in later years. Why is it important to learn about dysmenorrhea and to figure out if your child has dysmenorrhea? It is because it can affect the child in many ways, such as school absentees, limitations in social, academic, and sports activities, and just affect the child's overall quality of life. Risk factors that can predispose the child to more severe menstrual cramps are divided into two categories, just normal dysmenorrhea and severe dysmenorrhea. So risk factors for just dysmenorrhea in general is irregular menstrual cycle, low BMI or weight loss attempts, especially unhealthy weight loss attempts, family history of endometriosis, and endometriosis is a condition in which endometrium, which lines the uterus, is found outside of the uterus, or severe dysmenorrhea in other family members. Sexual abuse and depression as well. For severe dysmenorrhea, some risk factors include menarche, which is the age in which menstruation starts, is younger than 12 years old. Increased duration and amount of menstrual flow, meaning just heavier menstrual flow compared to others, low fish consumption, or smoking or passive smoking exposure. There are two types of dysmenorrhea, primary and secondary. Primary dysmenorrhea is the most common and can result in cramping of the lower abdomen. It can occur 24 to 48 hours before onset of bleeding and can continue for 3 to 4 days. 90% are purely caused by menstrual cramps, with the pain not caused by an underlying cause. So 90% are caused by just menstruation alone. The second type is secondary, which can be caused by another medical or gynecologic problem. An example of these problems could be endometriosis or pelvic inflammatory disease, and these are more common in older women that are 24 years or older with no history of dysmenorrhea. For the sake of this presentation, we'll be going over more primary dysmenorrhea compared to secondary since we're targeting the adolescent population. Now onto the pathophysiology and why these menstrual cramps occur. So prostaglandins are released during menstruation, and this causes contractions of the uterus. And if these contractions are too strong, it can put pressure and constrict nearby blood vessels, causing the oxygen supply to be briefly cut, and this can lead to the sensation of pain. There's a very nice illustration to your left, which clearly illustrates the process of why the menstrual cramps occur in detail. These contractions are actually normal, and they are needed for unfertilized eggs and the menstrual lining to shed. Studies actually show that women with primary dysmenorrhea make 2 to 7 times the normal amount of prostaglandins, so this may lead to more severe pain than normal. Common clinical presentations of dysmenorrhea include fatigue, cramping in lower abdomen or the pelvic area, fainting, headaches, low back pain, feeling nauseous, the need to vomit, or actually vomiting, having any type of pain radiating down the legs, feeling weak, or even signs and symptoms of diarrhea. Next, we will be discussing the diagnosis of dysmenorrhea. There are a couple of processes that need to occur before we can fully diagnose that the pain is caused by menstrual cramps alone. The very first process is the patient interview, and this usually occurs one-on-one between the adolescent and the doctor alone. Just because some of the questions are invasive of their privacy and they don't feel comfortable sharing it with their parents. Some of these questions they will need to prepare a log or a diary ahead of time before their doctor's appointment just so that the doctor can fully assess the pain. Some of these questions include description of the pain, whether it's radiating or locally appearing, the onset of pain, when did the pain start, where the pain occurred, whether it's in one area or has it spread to multiple areas, how long it has lasted or lasts, how it is usually relieved, whether they take pain relievers, hot packs, sexual activity history and use of contraceptions, whether or not they use condoms or birth control, history of pelvic complications just such as anatomical abnormalities, surgical history, anything that can indicate that the pain is caused by the pelvic complication rather than menstrual cramps just as a differential diagnosis, or any other symptoms that they could be having along with the pain, nausea and vomiting, anything from the clinical presentations on the last slide, or if they're experiencing other symptoms that can help diagnose as a different problem other than dysmenorrhea. For the next type of exam, we have physical exams. The very first type of physical exam is a pelvic exam, and this is not usually required unless the patient is sexually active. It acts more of a differential diagnosis to rule out STIs and any type of anatomical abnormalities rather than the diagnosis for dysmenorrhea. The second type of exam is abdominal exam, and usually you just put pressure on the abdomen and the doctor will check for the tenderness. With dysmenorrhea, they'll have mild suprapubic tenderness, and if it causes rebound tenderness, then it's due to a secondary cause rather than dysmenorrhea. Other types of differential diagnosis that can occur is an ultrasound or an MRI, which looks for any type of anatomical abnormalities that could cause the pain rather than dysmenorrhea. Lab tests can be done as well, such as a stool test, and this is just to see if there's any type of bacteria in the body that can cause the pain. Urine culture, usually this is to rule out UTI, whether the UTI is the cause of the pain or it's due to menstrual cramps instead. STI test, just to see if it's a sexually transmitted infection rather than menstrual cramps, or a pregnancy test. Now we'll be going over the management of dysmenorrhea with or without the use of medication. First, we're going to be going over non-pharmacological ways in which you can relieve the pain without the use of medication. This is usually the first line treatment, and we usually recommend this before the use of medication. The very first method that can be used is heat, and a heat patch that can be applied directly to the site of the pain, whether it's on the stomach or the back, or through a heat bag filled with hot rice or hot water can help relieve the pain, since heat actually helps relax the muscles, decreasing the amount of contractions that can occur. Next is exercise. Studies actually recommend stretching and yoga as the primary types of exercise that can reduce menstrual pains. There is a study called Effect of Yoga on Menstrual Pain, Physical Fitness, and Quality of Life of Young Women with Primary Dysmenorrhea, in which they separated participants into a yoga group and a control group. In the yoga group, they were asked to practice yoga for 30 minutes per day for twice a week for 12 weeks at home. For the control group, they did not do any type of exercise at all, and the study concluded that improvement in menstrual pain, physical fitness, and quality of life was seen far greater in the yoga group than the control group. Exercise was also seen to increase the body's release of endorphins that may help combat the pain. So if you don't want to do stretching or yoga, any type of exercise can actually help produce those chemical endorphins to help relieve pain as well. Next is vitamin supplements and minerals. This doesn't have to be through a pill or a gummy. It can actually be done through a healthy, balanced diet. So if you're actually deficient in any type of vitamins or minerals, it can actually increase the types of menstrual cramp pains. And so talking to your doctor and having a lab done to see if you're deficient in any type of vitamin or minerals, and then supplementing them through a healthy, balanced diet, and just getting good eating habits to combat that vitamin deficiency or mineral deficiency can actually help combat the pain. Next, we'll be going over pharmacological ways in which we can relieve the pain with the use of medication. The very first drug class is NSAIDs, and this is actually the first line treatment of relieving pains in menstrual cramps with the use of medication. Some drugs in this class is ibuprofen, diclofenac, mefenamic acid, and naproxen. Then we have Midol, and last line is hormonal contraceptives, which only is used if there is severe dysmenorrhea in which the pain can't be controlled with the use of NSAIDs or Midol. Now that we have gone over the management and the type of medications that can be taken to relieve menstrual cramp pains, we'll now be going over counseling points and important drug information that's needed to safely take these medications. The very first class we'll be going over is NSAIDs. There's 4 medications under this class that are approved to be safely taken in the adolescent population. The very first one is diclofenac, also known by its brand name of Voltaren. Its dosing is 50 milligrams 3 times daily as needed. And you'll notice that with all these pain medications, they are taken as needed just because they are only needed whenever there is pain and not as a scheduled dosing. The very next drug is ibuprofen, also known as Motrin. Its dose is 800 milligrams 3 times daily as needed. Mefenamic acid, also known as Ponstel, which is taken 500 milligrams initially, then 250 milligrams 4 times daily as needed. Naproxen, also known as naproxen, 500 to 550 milligrams twice daily as needed. And how these work is through a direct analgesic effect by inhibiting prostaglandin synthesis, so helping to decrease the amount of prostaglandins in the body, to decrease the amount of contractions, and leading to less pain. And it also helps decrease volume of menstrual flow. For this medication, you will need to avoid alcohol use with the medication. Common side effects is fatigue, dizziness, and any type of GI symptoms such as upset stomach or heartburn. And the GI symptoms can be reduced by taking the medication with food. Some things that you need to monitor is abnormal bleeding. The next medication is Midol, which is composed of acetaminophen, caffeine, and pyrilamine. The dosing is to take 2 tablets with water and repeat every 6 hours as needed. One dose is 2 tablets. It contains 1,000 milligrams acetaminophen, 120 milligrams caffeine, and 30 milligrams of pyrilamine. And it is important to not take this medication with any other medication that has acetaminophen in it, such as Tylenol, just because there is a set amount of acetaminophen that can be taken in a day, and this can easily cause an overdose. And this medication is indicated for children older than 12 years old, and if they're younger than 12, they'll need to consult a doctor before taking it, and alcohol should be avoided with this medication as well. Next is contraceptives. There are different types of contraceptives such as pill, vaginal ring, an IUD, patch, Depo-Provera shot. And how this works is by decreasing the amount of prostaglandins, so it decreases the amount of contractions that causes the menstrual cramps, and it also decreases the amount of blood flow during menstruation, so the same way that NSAIDs work. This medication, you need to regularly take it, and common side effects is nausea, breast tenderness, bloating, mood changes, and this usually improves after 2 to 3 months of use. If you forget the pill, it can cause irregular bleeding or spotting.